Today we are gathered here, joined by partners, the county government of Tharaka Nithi, the partners such as IDE, Vitamin Angels and Helen Keller through the Transforming Lives Through Nutrition program. And we are gathered here as a part of series of events commemorating the World Breastfeeding Week. We recognize breast milk as the ultimate superfood, and we are committed to support causes such as providing capacity building. We have trained healthcare workers and community health promoters to ensure that they're able to reach the households and provide education not only to the mothers but the whole households for our role in supporting breastfeeding. We also work with partners and working on the provision of integrated services, recognizing that breastfeeding starts even during pregnancy, that mothers or pregnant moms need education, and that it's the simple things, the practical support that we've been offering that enables our moms to support in terms of attachment, latching, and having that supportive environment for breastfeeding. We recognize breastfeeding also as essential for nutrition in terms of immunity, cognitive development, and the holistic development for our children. This is part of our Hope Corps programs, whereby it supports our maternal and child health programs in ensuring that they have support and the community is empowered in recognizing the best practices that support the maternal and child health. So in Kenya, we recognize that 6 out of every 10 children are exclusively breastfed. That's why we have taken up for us to ensure that every child is exclusively breastfed and their caregivers receive that support. We are also working with partners to ensure that our women get the best care and thriving environment for them to breastfeed, such that out there it needs to be known that breastfeeding is not only for women but the whole family has a responsibility to ensure that our mothers receive the best environment and support, which goes towards this year's theme on strengthening what works.
Are there any challenges maybe that hinder or maybe women face, mothers face in terms of breastfeeding, and how can you address them, or maybe what are you doing to address some of these challenges?
One of the common challenges and barriers we are trying to break is that we have come to realization that what we perceive to be basic knowledge is not quite known out there. Our mothers need education and practical support to know how to do the breastfeeding, when to do it, and even how we're able to transition from just breastfeeding to even complementary feeding. That's where we've come up, and even as part of today's activities, without those practical demonstration. Secondly, one of the gaps we are trying to break is that there has been that limited role of partner support, not only in terms of breastfeeding, but also the support for the holistic care, including even those antenatal clinic visits, whereby caregivers are able to receive that support. So we are shifting the conversation of breastfeeding from just the mothers to the whole family and the community as a whole.
Na sasa kunyonyesha mtoto for 6 months hakunanga shida yote, huwezi usikia mtoto anaoma, huwezi kuwa unasikia mtoto ako na shida ya tumbo. Njoo hizi ukikula vizuri, hizo vitu nakula zinaenda mpaka kwa mtoto. Hakuna maana ya kupea mtoto maji unakunywa maji ya kutosha ndio mtoto apate hiyo maji kupitia wewe. Sasa tumefunzwa mambo mingi sana kuhusu watoto wetu wanakuwa vizuri tangu tuanze hiyo masomo ya malezi bora. Watoto wetu tumechange sana kama hii community, na tunawashukuru sana.
Vile vitu unakula ndizo mtoto anakula. Ukikula chakula unaongezea na matunda na maji kwa wingi, hiyo kitu inasaidia mtoto sana, na mtoto anakuwa na afya mzuri. Mimi ningewaambia hata ukinyonyesha mtoto, hata ukipata watoto 10, ukinyonyesha mtoto nyonyo itakuwa sawa.
Mimi wakati nazunguka huko vijijini, huwa tunapata wamama wengine hawataki kunyonyesha watoto. Wanasema matiti yao itakuwa imeteremka sana. Wengine wanataka wasinyonyeshe mtoto, wananunua maziwa ya nani. Tunapata hata wamama wengine wanasema hawana maziwa ya kutosha, wanaanza kulisha watoto, wanasema wanawapea uji ambayo wanachukua ile iko na unga changa kidogo sana ndio mtoto aweze kushiba.